How to place a temporary tracheostomy tube. Patient must be under general anesthesia. Position in dorsal recumbency, extend the neck, make sure it's straight, and support under with a rolled up towel. Perform a routine surgical clip in preparation of the site and wear sterile attire. Make a 2 to 5 ventral cervical midline skin incision, starting at the cricoid cartilage and extending towards the sternum. Separate the sternohyoid muscles bluntly and retract them laterally. Gelpi retractors are super handy for this. Remove the peritracheal connective tissue where the tracheostomy will be placed. Be careful not to dissect too laterally. This avoids damaging the left recurrent laryngeal nerve and tracheal arterial blood supply. Make a transverse incision in the annual ligament between the third and fourth or fourth and fifth tracheal rings. Don't go further than 50% of the tracheal circumference. Place long loop stay sutures around the cranial and ventral tracheal rings and clearly label the sutures as top and bottom. Close the surrounding muscles and skin. Secure the tube with umbilical tape sutures or commercial tube ties. Remember the ties must be easy to remove quickly in case of emergencies.